Okay, so with knowing what you know so far with how we've been going the past few weeks, when you think of shoulder exercises or shoulder movements you want to do in a patient that's has like let's just say non-surgery and they just have problems and pain going up with their shoulder. How are you thinking through that when you want to do a little bit more advanced exercises? Not table stuff, not wall slides. What's your first thought?
So I think the first thing that I always think about is asking the patient, what are your goals? So obviously they're going to say, oh, I don't want to be in pain. Like we know that's a main goal of like everybody. But after doing that, I'm kind of thinking of activities of daily living. Like what are they going to be required to do? Reach into a cabinet, reach below and grab something, maybe, wash their back when they're taking a shower. So I'm thinking of all of the different motions. So shoulder flexion, extension, internal, external rotation, things like that. So with that in mind, now I'm thinking, okay, with those movements that I want to accomplish, how can I do that in a more functional way? So a lot of times, like I just asked, we do like a lot of shoulder exercises at the table, whether it's like a wall slide or maybe laying on their side, an internal external rotation, something like that. So now it's like, okay, how can I still do those same movements, but now how can I have them do that while they're maybe walking? Because in everyday living, they're not going to always be doing something at the table, sliding their arm. They may be walking and trying to grab something. They might be reaching, into a bottom of a cabinet. They may, you never know. You might have to quickly reach behind you and grab something, and that's shoulder extension. So, keeping those things in mind, now I'm thinking, okay, how can I accomplish all of that in this large gym that we have here?
Cool. So now taking in the principles of neuromuscular inhibition, reciprocal inhibition, functional activities, how the muscle fibers run, the planes of motion the joints go through. Um, what comes to mind first for you to have them do to address all that?
So what I'm thinking is, for example, a let's say shoulder flexion. So with shoulder flexion, obviously your arm is going, in this motion, and I'm thinking, okay, I could possibly maybe have them hold a weight above their head and walk at the same time.
Before that, what contributes to shoulder flexion? Let's just say scaption because nobody really goes like that all the time. Let's just say scaption, which means a little bit between flexion and abduction. What muscles make that happen?